Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, more worries as Nigeria continues to record an increase in number of coronavirus cases. Lagos and Oyo, top two states and the Federal Capital Territory with COVID-19 infections as health experts warn against rising numbers at community level. And global COVID-19 cases surge over 10 million as death toll passes 500,000, according to the Johns Hopkins COVID-19 Resource Center. The Nigeria Center for Disease Control, NCDC, recorded 490 new cases of COVID-19 spread across 20 states, including the Federal Capital Territory. Of the new cases, Lagos State has 118, Delta State recording the second highest daily figure for the first with 84 cases, Ebonyi 68, the FCT 56, Plateau 39, Edo 29, Katsina 21, Imo 13, Ondo 12, Adamawa 11, Osun and Ogun 8 each, Rivers 6, Kano 5, 3 each in Enugu, Bauchi and Akwa Ibom, and 1 each in Kogi, Oyo and Bayelsa states. The total confirmed cases now stands at 24,567 with 9,007 recoveries, but the death toll is put at 565. 14,995 cases are the total active cases in the country. So far, the top 3 states with the highest confirmed cases are Lagos, the FCT, and Oyo State. Oyo State now has 1,306 cases, displacing Kano State, which has 1,200 cases. To a breakdown of the highest cases in each of the 6 zones, it shows Lagos topping in the southwest and the country with 10,144 cases. The FCT in the north central has 1,792 and Kano in the northwest with 1,200 cases. River State still tops in the south-south with 1,056 cases. Bauchi in the northeast with 500 cases, while Ebonyi once more displaces Abia to lead in the southeast with 395 cases. Now, all evacuees who arrived on the Air Peace flight P47801 from Heathrow in the United Kingdom last night have now proceeded on 14-day self-isolation as mandated by the Nigeria Center for Disease Control, the Federal Ministry of Health and the Presidential Task Force on COVID-19. In a tweet by the Nigerians in Diaspora Commission, NIDCOM, 317 Nigerians, including 9 infants, arrived in Nnamdi Azikiwe International Airport, Abuja, at about 9:50 p.m. local time after testing negative to the virus before departure. On arrival in Nigeria, 175 passengers disembarked in Abuja, while 142 proceeded to the Murtala Mohammed International Airport, Lagos, for a onward journey to their destinations. And 93 more COVID-19 patients in Lagos State, comprising 16 females, 77 males, including 11 foreign nationals, have been discharged from the isolation facilities to reunite with society. The patients, 11 from Agidingbi, 22 from Bagada, 36 from Lekki, 8 from Etiosa Landmark, that is, 9 from Onikon, 7 from Luth isolation centers, were discharged after full recovery and testing negative to COVID-19. Well, this brings to 1,592 the number of COVID-19 confirmed cases that have been successfully managed and discharged in Lagos. The state government continues to appeal to citizens to adhere strictly to the safety protocols on COVID-19. And following the increasing rate of COVID-19 cases in Cameroon and due to its proximity to Cross River State, which has no confirmed case of COVID-19, the state government is appealing to the federal government to strengthen security at the boundary points between Cameroon and Nigeria to forestall border entry from Cameroon into the state. The representative of Danare 2 in Boki local government area, who's also the State Commissioner for Works, Mr. Dane Osimasu, was speaking at a routine monitoring of the boundary. He's used the occasion to educate the people on the need to adhere strictly to the guidelines and the preventive measures on COVID-19.
That other community is an international border community. That's why I am sent here. And we are sent here, like I told us, in the first and second, my second trips here, and in all the times I've been here to start to sensitize us, to inform you about the dangers of this disease to human life. Our location here is at the borderline between Nigeria and Cameroon. And for us, our situation is precarious, it's difficult because we are traditional people, we have relationships with Bodam, we have relationships with Daddy, we have relationships with Gekugesam. They are our brothers by blood. It's not so. Yes. But the danger of this disease is that this sickness does not know brother, does not know friend, does not know sister. And I have been here. I'm happy and I thank you. And you remember to be conscious, to put on your nose mask all the while. That saves you, first of all, without medication.
Well, let's go to Borno State, where our correspondent Blessing Tuno Aso in Maiduguri brings us this update.
Estimated 5.8 million people living in Maiduguri, and more than 50% of that number reside within Maiduguri, the capital city, and this is a result of mass displacement. Recall that at some point, up to 20 local government area were living in Maiduguri, but now a sizable number of displaced persons have been returned to their respective local government areas, but still Maiduguri is still densely populated, and what this means is that facilities are overstretched, and in the event of community spread, there isn't that capacity to manage it. Now, for instance, the population of Maiduguri is divided into three. We have the members of the host community, we have IDPs living in the host community, and we also have IDPs living in makeshift camps. Now, also remember that there are refugees in neighboring countries. Just last week, we heard about the return of 7,000 people from the Republic of Cameroon to Banki town, a border town in Bama local government area. Now, with this population dynamic, it has proven really hard to get the people to obey instructions, and in the event of community spread, it will be harder to manage it. But what we have is people often wishing away the community spread, but very little is done on their part, as people have now relapsed to their normal way of living. From Maiduguri, I am Blessing Tuno Asa for COVID-19 updates.
While staying in the north, COVID-19 has brought some creativity into learning in Nasarawa State as high school students avail themselves the opportunity of a mobile library. The state government initiated a mobile library program to help secondary school students study while they stay at home during the enforced closure owing to the pandemic. The program is also to prepare the students for their national terminal examinations. Our correspondent Halima Gaya has more.
Shifra and her team of volunteers from the SDGs department, books to read for the week are put in the bag and they set out. Their destination is Government Secondary School, Odorogia, Doma local government area. The school principal receives them and ushers them to the classroom. The review cannot begin without taking safety precautions. The mobile library, which is birthed due to the closure of schools, is what brings Shifra and her team here. In the program, books are given to high school pupils to read for 1 week, after which her team and the students converge again for a review.
To find new words, you have a dictionary at home. You have a dictionary at home. The target is to get at least 50 students every month having to read at least 4 books every month, and then at the end of the 1 month, we should have recorded some improvement in their vocabulary, in their spelling, and then prepared them for their national and terminal exams subsequently.
This was a gathering of 6 to 5 pupils, but today they have risen to 13.
Due to the mobile library program that we brought to our school and giving us books to read, and I got to understand so many things at times, reading and spellings, and some words that I've never meant before.
99% of the students are farmers. But with this idea, the students are happy, and that's why you can see them partaking in the activities fully.
The coronavirus pandemic has affected educational systems worldwide. While some containment restrictions in Nigeria have been relaxed, the schools have remained closed. The Nasarawa State Mobile Library Initiative is helping these youngsters to instill a habit of reading while they stay at home. But what happens to the program post-COVID-19? The Senior Special Assistant on SDGs explains.
Well, actually, with the result we are getting out there, I think it's a very laudable, welcome stuff. A lot of students are coming in and gearing up to be part of it. I think we're going to sustain it even after COVID-19. Because one thing we also learned is the fact that not all students have textbooks with them. And then, since we do not have a common library grant that we can say people should come, we try to see how we can reach them and then get them excited about these things.
The mobile library may not encompass all subjects, but it gives these pupils a feeling of being in school and prepares them for their national and terminal examinations. Halima Gayam for COVID-19.
Vaccination is one of the most effective ways to prevent diseases. A vaccine helps the body's immune system to recognize and fight pathogens like viruses or bacteria. But as the global race for COVID-19 vaccine continues, the WHO is appealing for the ingredient of solidarity to ensure equitable access. And joining us is Mrs. Olufunto Olude, a chief pharmacist with the Federal Neuropsychiatric Hospital, Yaba. She's in charge of drug supply management. Thank you for joining us on the program.
Thank you for having me.
So tell us, how close are we in terms of the global efforts to finding a vaccine for COVID-19?
Well, we're very aware that there had been about 200 candidates for the vaccine development against COVID. But right now, we're sure of about 2 that are very close. We know that one of them is looking at the end of 2020 for us to be able to have access to these vaccines because, of course, they're already with them in human testing stage right now. But, you know, it's a race against time. It's actually a race against time. And we know vaccines for now, of course, is the way to protect most people. But we hope soon enough that these trials will pass that human stage and people will have access. But of course, you're talking about lots of money going down, and how do we take advantage of this, even as Africans?
Exactly. I was going to ask where Africa ranks in all of this, and seeing as the worry of the World Health Organization is accessibility, saying there should be solidarity as this search is on.
Yes, of course. At this point in time, collaboration is key. We are aware that, of course, South Africa has already collaborated with University of Oxford in terms of the trials to ensure that these vaccines are able to go global in terms of Africans also being able to have access to it. But I know that we're a little behind, but I'm sure we will find a way. But I think the key thing is for Africa as a continent to collaborate, because these things are very expensive. So you're looking at access in terms of funding. How do people get access to it? The vaccines are supposed to be used for the vulnerable. Of course, the first people that we get to is those who are vulnerable, health workers, police, those who have pre-existing conditions, you know, and the elderly. But now we're looking, how do we have access to it, which has to do with funding. So it's important that we gather the funds together, see how we can take advantage as fast as possible, because remember, the whole world is waiting for these vaccines.
Looking at Nigeria and our peculiarities, in terms of supply of drugs, do you think we will face any challenge?
Like in the beginning of the lockdown, since there was restriction in flights, you know, largely Nigerians, we are importers of medication as well as even the APIs for manufacturing. So we had a little challenge. In fact, it will be a major challenge. Globally, supply chain in terms of drug management is really going to be a challenge because most of these drugs are gotten from China or from India, even the APIs. So we're talking about the active ingredients in producing the drugs. Even if we're going to enable the local manufacturers here, we're looking at how do we get these things in. As we begin to ease the lockdown, I believe access will increase, but we'll have to think of innovative ways to ensure that safety protocols are followed in terms of getting the drugs in and ensuring that Nigerians have access, lest we have another problem with compliance when the drugs are not available.
All right, we appreciate your time, Mrs. Olufunto Olude, Chief Pharmacist. Thank you for joining us on the program.
Thank you for having me.
We have more on the COVID-19 update when we return. Over in Plateau State, the state government says it is taking extra measures to enforce the directives aimed at curbing the spread of the virus. This is following an increase in COVID-19 infections after the total lockdown was lifted in the state. The secretary to the state government and coordinator of the state's COVID-19 response, Professor Dan Ladi-Atto, told journalists in Jos, the state capital, that emphasis will be placed on 6 local government areas where there is high prevalence of COVID-19.
The enforcement teams will wage a robust action on defaulters, whether citizens or organizations, particularly in the 6 local governments, which include Jos North, Jos South, Bakin-Ladi, Mangu, Kanam, and Kanke. It will be understood that the next phase will see other local governments also witnessing this type of enforcement and enlightenment that we shall launch tomorrow. This enforcement will go simultaneously with public education campaign by health educators and National Accreditation Agency to further enlighten the citizens on the dangers of the disease and what to do to be protected. It is important to make it abundantly clear that this action is not in any way aimed at stigmatizing people living in these local government areas or affected communities, but an exercise targeted at ensuring their safety and containment of the pandemic. We shall remain focused on ensuring that we protect our citizens from the coronavirus pandemic. All we continue to ask for is the cooperation and support of all citizens towards defeating the disease.
Well, taking a closer look at ways we can stop the community transmission, joining us in the studio is Dr. Adesina Adega. He's the Director of Research and Innovation at Mountaintop University. Thank you for joining us on the program. All right, so we're looking at several measures states are taking, in terms of leading the response, COVID-19 response in the various states. In terms of the federal government's response and that of the states, and of course our research on COVID-19, what new thing have we learned? Because we know that, they've been saying this is a fairly new virus and things keep coming up every day.
Well, the issue that as new drugs are coming in, there's a care for that. Because in the use of the drugs, you need to have the safety of the users. The safety of the users is very, very paramount. A lot of drugs have been suggested, especially the one imported from Madagascar by the president, and that's why it is still going on under investigation right now at the NAFDAC. And that's how it should be. And then no matter how hasty we are, the end result of the user's safety is very, very powerful, so that we don't have complicated problems in our hands.
And that's why it's taking this long.
Yes, that's why.
Now, there is a professor of virology who talked about new strains which might have complications on severity, diagnostics, and vaccines. According to him, Professor Oyewale Tomori, he says that the higher the chance of the virus to mutate, the more there is community transmission, and that this might now form a new strain that will become peculiar to Nigeria.
The attitude of our people can give chance for mutation, in the sense that when there's no compliance with government directive and the history of the virus, COVID-1, COVID-2, they are emerging. They are emerging with new strains. And then due to the carelessness or even due to the vector through which they are emerging to an infecting man, as a result of that, there's danger for emergence, and that's why the Professor Tomori expressed that idea. And once that is happening, the danger in the vaccine production will be there, because if the vaccine eagerly being produced now, if they don't have cross protection on all the varying strains that could be emerging, that's the danger. That fear is being expressed in the U.S. right now, because well, it is true that the main base of the protection is through vaccine, and we go for it. But notwithstanding, attitude of our people, giving room for mutation of the virus is something government has to be careful, really be careful. And we can prevent that by forcing compliance.
Enforcing compliance, are you saying government should go as far as locking down?
No. Enforcing people in the community to put on face mask, because this virus is aerosol in transmission, and it sticks to every membrane of the body. And once it sticks, get it. And for the vulnerable, the elderly, the sick, and those that are having underlying diseases, they succumb. So that's the danger of it.
Finally, sometimes the federal government says that out of the numerous claims of the COVID-19 herbal cure forwarded for validation, that there are about 3 with potential. Do we know more? Do we have more on those 3? And indeed, what is being used to manage the COVID-19 cases in Nigeria?
The drugs that I imagine for coping all this COVID, because everybody is eager to see get solution. And most of this law, as long as it's passing through NAFDAC, and NAFDAC is doing the needful to it, everybody is under safety.
All right, we appreciate your time. Thank you so much, Dr. Adesina Adega, Director of Research and Innovation at Mountaintop University. Thank you for joining us.
Thank you.
More than 500,000 people have died after contracting COVID-19, with half the world's cases in the US and Europe. Outbreaks are still spreading in many parts of the world, with 1 million new cases recorded in the last 6 days. 4 countries reporting the highest number of deaths are the United States, Brazil, the United Kingdom, and Italy. Meanwhile, the total number of infections worldwide stands at 10 million, a little over 10 million cases. Now, according to the Nigeria Center for Disease Control, face shields without the face mask are not effective in COVID-19 prevention. The face shield, they say, is not a fashion accessory and must be combined with a mask to provide significant protection. It protects only the face, but with the face mask, it curbs the spread of respiratory droplets. You can visit their website and find regular updates on COVID-19 regulations and the guidelines. Now, from the World Health Organization's website, your questions are answered on the coronavirus disease situation. You can find the latest global numbers by country of COVID-19 cases on a daily basis. They also have regular updates with strategies and plans to curbing the virus across the board. You can take a closer look at some of the numbers in real time. Our website, channelstv.com, yes, has the latest information on the pandemic and other news and health, business, politics from Africa and around the world. Log on, that's channelstv.com. Well, that's our COVID-19 update. Thank you for watching. I'm Millicent Walker. See you again at 6.